Since the first doses of COVID-19 vaccines arrived in Guyana some 3 months ago, 223,659 persons have taken at least one dose. But medical studies have shown that it is those who will get two doses of the vaccines who will have added protection against the virus and not become seriously ill because of the COVID-19 disease. So far, 92,157 persons have taken both doses of either the Sinopharm, Sputnik V, or Astra-Zeneca vaccines.
The vaccines that we currently have in Guyana and those that are, I would say, globally, they are all very good vaccines. They work, they're effective, they're safe. As of this week, the WHO would have said about 2.2 billion persons would have received vaccines. So we know that these vaccines are working and they're protecting people from getting the disease. We have started our campaign maybe about 14 weeks ago. And since then, we have had a number of persons who would have received both doses of the vaccine. And all of those persons who would have received both doses of the vaccine, none of them have been hospitalized, none of them have come to the ICU, and none of them would have died from COVID. So if there's any proof that anyone would like to have, in a sense, here is the proof that this thing is working. Because none of those persons have come to the hospital or died from COVID. So it's very clear, if you take both doses of the vaccine, you are going to be protected. And that's what we want, people to be safe and protected. So I really want to urge everyone to make sure you take your vaccine, get both doses, and once that happens, you are going to be protected.
During his daily COVID-19 update, Minister Anthony pointed to the availability of vaccines at this time.
So everyone who would have received their first dose, Sinopharm or Astra-Zeneca vaccine, we have your second dose. Now, after the first dose, we want you to come back at least 4 weeks after to make sure that you get your second dose. So that goes for Sinopharm. Between 4 weeks to 12 weeks, anytime within that period, you can come back for your AstraZeneca second dose. And for the Sputnik V, initially we were saying after 4 weeks. Now we have received information from the Gamaleya Institute, the people who would have manufactured Sputnik V, and they're saying that you can get your second dose within 4 weeks to 12 weeks. Now, we have, as we have said before, we have AstraZeneca in country, we have Sinopharm in country, so for those two vaccines, come and get your second dose. For the Sputnik V, which is a totally different vaccine for your second dose, we don't have in country right now, but we are making the arrangements to make sure that we can get it in as soon as possible. And as soon as we get those vaccines in, because I know a lot of people have been eagerly awaiting for the second dose to come in, as soon as we get it in, we'll announce it so that across the country people can go and get their second dose Sputnik V.
Recently, the world's most powerful nations pledged to share COVID-19 vaccine doses internationally in support of global equitable access and to help end the acute phase of the pandemic. G7 countries committed to share at least 870 million doses of COVID-19 vaccines directly, with the aim to deliver at least half by the end of 2021, and reaffirmed their support for COVAX, the Global Vaccine Alliance, as the primary route for providing vaccines to the poorest countries. For the newsroom, I am Shakima Day.